Hi there, I'm the neuromuscular mechanic, and today we're going to be talking about ultrasound-guided acromioclavicular joint injections. I'll be showing one type of in-plane injection. So what are the indications? These can be used for joint arthritis. That can be osteoarthritis, inflammatory arthritis, traumatic arthritis, as well as AC joint osteolysis. Now, when I think of these injections, I always like to have a checklist. My checklist includes having the right patient positioning to start, identifying the correct transducer, knowing where to put the probe on the patient to start, so having good surface localization, the structures to look at your pre-scan, and then the target structure. So patient positioning, I prefer to have the patient seated with their arm by their side, relaxed, supported by a pillow. When I look at the transducer that I use, I prefer a linear high-frequency ultrasound transducer. Again, this is a very superficial structure, so this is what works best. When I think about surface localization, you can find the joint through palpation, so you can palpate along the clavicle from medial to lateral until you appreciate the joint, and then you can just put the ultrasound probe right there in transverse orientation. Not many structures to identify on pre-scan, the clavicle and the acromion, because they allow you to identify the target. And then our target is that joint. We want to get under the joint capsule, which you can often identify well. I prefer to go from lateral to medial, and to facilitate this, I often use a gel standoff, building up the gel in the lateral aspect under the probe to get the needle in. So here I am, I have the ultrasound probe transverse plane hanging off the acromion. And so if I label the structures here, I have the acromion on the left of the screen, and then I have the humerus in the bottom right with the overlying supraspinatus. So I need to move the probe more medially here, that you'll see. So as I move the probe medially, now coming over the acromion, a little bit further, and now I'm starting to see the clavicle. So I'll pause here, but there's the clavicle on the left and the acromion on the right with the hyperechoic bone. Again, the orientation of the two relative to each other might differ based on joint sprain. And here is the AC joint in between them. You'll notice that there's a nice hypoechoic anechoic joint capsule. That's what we're trying to target. So when I do the injection, you can come from in plane, lateral to medial, and maybe use that gel standoff to bring that needle under the joint capsule. Now, I'm not showing it on these videos, but if you had this view, you could rotate the probe 90 degrees to do an injection from an anterior to posterior direction. So that ends our lecture today. I'm the neuromuscular mechanic, and I hope you found today's episode handy. Thank you.